my father, who passed away 2 years ago. So I went into hospital with pneumonia, but we found out he had a tumour. He was in the hospital for 11 weeks. Unfortunately, we just felt that the information wasn't forthcoming. We felt we had to fight a lot to try and get that information. And we didn't really, when we found out about the tumour, we didn't really want our father to know, because we felt he would give up the fight. Unfortunately, he did. They told him, and 2 days later he passed away. So it's just, we felt we weren't equipped with the information, and it was hard to get that information. So we feel if families in the future, if they could get that information, and maybe they could deal with it. We felt we couldn't plan. We didn't know how, what was coming down the line, how much time we had. We were told, 6 months to a year, and then 2 days later, unfortunately, he passed. Whereas we would have preferred maybe he'd been in a situation where he could have died in a more dignified way. Unfortunately, he didn't in the end. And if we had known what kind of time scale we had, we would have liked to maybe put into action a way where he could have been in a nicer environment where he could have gone peacefully.
Every cancer journey is different, and nobody likes to hear the words that they have a cancer diagnosis, and every 2 cases are different. But even the most simplest cancer journey can be very difficult. It can be fraught with psychological impacts. It's a life-changing experience. Some of the cancer treatments are more toxic than others. Thankfully, there are a lot of great new innovations and new treatments now available that patients seem to tolerate more readily. But having said that, the impact on a patient, on their families, on their caregivers is not to be underestimated. So organisations like the Marie Keating Foundation and other cancer support services and centres provide a range of support services and information to cancer patients. So it would be very helpful if more doctors, GPs, healthcare professionals, oncologists could signpost patients to those support services. They're generally provided around the country. In the case of our own Survive and Thrive programme, that is run on a countrywide basis at different times in the year. It's available free of charge to all cancer patients, and can be of tremendous assistance to cancer patients who are making that transition back to the new normal after a cancer journey.
The range of services we provide include counselling, hospital transport. We have a drop-in support centre, so people can access the centre at any time to receive support in relation to dealing with a cancer diagnosis, but then also dealing with the effects of the treatment, and then also dealing with emotional and mental health side effects of cancer treatment. We also support children who are affected by cancer through art therapy and play therapy, and help children who have a sibling who have cancer as well, to help them deal with the effects of the diagnosis. Each person is different, and each person has a different approach to dealing with their own cancer illness. So we believe that they have a right to the appropriate service that meets their own particular need, and also where they are at a particular stage in their lives. So they may be young, they may be older, they may be working, they may have just started a family, and we believe it's important that a person receives the needs appropriate to their stage in life. So for example, if they come to our centre for counselling, if that's what they so need, that service is provided, and also that they are aware of the range of services that are provided at community level to meet their own particular needs at a certain point in their lives. More collaboration with our partners, in the health system, and also at local community level. There's a shift now towards primary care, and we work quite closely with the HSE locally in our area in Wicklow, and we believe more collaboration there is what's needed, and more input, let's say, of our experience on the ground. We're frontline, meeting the patients on a daily basis, so we believe that more input at that level, I think, will lead to a greater output for the patient.
People who come to us are affected by cancer. They're either the patient themselves, or they're a family member or a loved one. And a cancer diagnosis brings a roller coaster of emotions. It's a tsunami that hits you. You can't cope. You have fear, anxiety, stress. A lot of our clients get told about us through word of mouth. It might be the person sitting beside them in hospital, it might be the clinical nurse specialist, the oncologist, somebody who's time to talk. And that's wonderful when we know that they can come across the road to us and avail of the many services we have. And what I would love to see is, from the time of diagnosis and throughout the patient journey, that they have touch points where they are told about what services are available to them. Because yes, the hospital will treat the cancer, but the patient is a patient as a whole, and they have psychological needs, they have financial needs, they have so many other things. They have worries about how to tell their children they have cancer. They want to know what benefits, entitlements they have. They want to talk to others in the same situation, and to have a laugh with them and to cry with them and just to get that peer support, which is massively important. And I would love that the hospital setting and the primary care setting, that we all just work together to kind of make those referral pathways throughout the patient journey, because we all know better intervention and earlier intervention means better outcomes in all aspects of the patient's journey. ARC was represented on the patient advisory group for the National Cancer Strategy, and there's now another patient advisory group going forward to implement the strategy. So we, representing patients, are very much involved in developing that. And then from the other side of things, for example, the clinical lead, the national clinical lead in psycho-oncology, has shared her plans with me there a few weeks ago about her big focus on education, and it's education of the healthcare professionals, mainly in the hospitals, so that they are aware of what supports are around them, both within the hospital setting and external, in the community where we are, and can signpost patients to them.